Welcome. In this video, we'll be discussing amyotrophic lateral sclerosis, also known as ALS or Lou Gehrig's disease. ALS is a progressive neurodegenerative disease that affects nerve cells in the brain and spinal cord, leading to muscle weakness, paralysis, and ultimately death. The exact cause of ALS remains largely unknown, making it a complex and frustrating disease to understand. About 5 to 10% of ALS cases are familial, meaning they are inherited through genes passed down from parents to children. However, the vast majority of cases, around 90 to 95%, are sporadic, arising without any known family history or clear cause. Researchers are actively investigating several factors that may contribute to the development of ALS, including genetic mutations, environmental toxins, abnormal protein accumulation, and immune system dysfunction. ALS attacks motor neurons, which are nerve cells responsible for controlling voluntary muscle movements. In ALS, these motor neurons progressively degenerate and die. As the motor neurons die, the brain loses its ability to initiate and control muscle movement. This leads to muscle weakness, twitching, and eventually paralysis. The disease typically affects the upper motor neurons, located in the brain, and the lower motor neurons, located in the spinal cord. Damage to both types of motor neurons leads to the characteristic symptoms of ALS. ALS affects people of all races and ethnicities, but it is more common in Caucasians. It typically strikes between the ages of 40 and 70, with the average age of onset being around 55. Men are slightly more likely to develop ALS than women. While ALS is considered a rare disease, affecting approximately 1 to 2 people per 100,000, the global impact of this devastating condition is significant. The symptoms of ALS vary from person to person, depending on which motor neurons are affected first. Common early symptoms include muscle weakness in the arms, hands, or feet. This weakness may manifest as difficulty lifting objects, tripping, or clumsiness. Other early symptoms include muscle twitching, cramps, and slurred speech. As the disease progresses, muscle weakness spreads throughout the body, affecting the ability to walk, talk, swallow, and breathe. Eventually, individuals with ALS may become completely paralyzed, requiring assistance with all aspects of daily living. Cognitive function is generally preserved in ALS, but some individuals may experience cognitive and behavioral changes. Diagnosing ALS can be challenging, as there is no single test to definitively confirm the diagnosis. The diagnostic process typically involves a combination of neurological examinations, electromyography, and EMG to measure electrical activity in muscles, nerve conduction studies to assess nerve function, and magnetic resonance imaging (MRI) to rule out other conditions that may mimic ALS. A thorough medical history and physical examination are also essential. Diagnosis is usually made by a neurologist, who carefully evaluates the patient's symptoms and test results to exclude other possible causes. While there aren't distinct classifications or types in the traditional sense, ALS is often categorized based on where symptoms begin. Bulbar onset ALS starts with difficulty speaking and swallowing, while limb onset ALS begins with weakness in the arms or legs. The progression of the disease may also differ between individuals. Currently, there is no cure for ALS. Treatment focuses on managing symptoms, improving quality of life, and prolonging survival. Medications, such as riluzole and edaravone, may help slow the progression of the disease. Other treatments include physical therapy to maintain muscle strength and mobility, occupational therapy to adapt to daily living activities, speech therapy to improve communication, and respiratory support to assist with breathing. Nutritional support is also crucial, as many individuals with ALS experience difficulty swallowing and maintaining adequate nutrition. Palliative care plays a vital role in providing comfort and support to patients and their families. Because the cause of ALS is largely unknown, there are no proven ways to prevent it. However, researchers are investigating potential risk factors and protective measures. Maintaining a healthy lifestyle, avoiding exposure to toxins, and engaging in regular physical activity may potentially reduce the risk of developing ALS, but more research is needed in this area. The prognosis for individuals with ALS is generally poor, with an average survival time of 2 to 5 years after diagnosis. However, some people may live much longer, even more than 10 years. Recent research has focused on identifying new genetic mutations associated with ALS, developing novel therapies to target specific disease mechanisms, and improving the quality of life for individuals with ALS. Clinical trials are ongoing to evaluate the safety and efficacy of new drugs and interventions. While a cure remains elusive, researchers are making progress in understanding ALS and developing more effective treatments.